Good morning, everyone. Thank you for joining our webinar this morning, where we're going to give you an update on coronavirus. So this is forming part of the webinar series that we're doing. So this is part 5. So a bit of housekeeping before we get started. So for those that haven't joined any of these types of sessions before, this is a broadcast. So unfortunately, we can't hear any of your audio. Hopefully you can hear ours. If you do want to ask any questions, and we're going to save quite a bit of a time at the end for some Q&A, then there is and I'll go on to a slide on to exactly where it is, but there is a question box on the GoToWebinar software, and you can put a question in there. Hopefully we'll get it answered today. If we don't, what we've been doing as part of these webinar series is going back and answering the questions, going directly to the person who's asked the question and going back with the answer. We've also going to look to share all the questions that we get and the answers, get them all shared, so everyone's got a copy of those as well. So feel free to add any questions. In terms of timing, this session is going to be slightly longer than what we normally do. We normally do half an hour. We've set it to 45 minutes. Only because we were getting quite a lot of people asking how we can and what we've been doing to support businesses. So we've got a few slides, and I'm going to talk through myself and the other presenters on the webinar today. We're going to talk through some of the products and services that Moorepay have got on offer that can support businesses through these difficult times. Hopefully you can all see my screen. You should see a PowerPoint now. And in terms of introductions, we've got a slide that introduces them a bit more formally. But on the call today, there's myself, Daniel Cookson, I head up our product marketing team. We've got Audrey Robertson, she heads up our HR consultancy team. We've got Phil Barker, who heads up our health and safety team. And we've got Michelle Hobson, who heads up our whole HR services team. So if we get started then, in terms of agenda, we're going to go through some latest stats and some latest guidance from the government. We're going to go through some legislation updates, and the one that's come out more recently is the job retention scheme. So we're going to spend a bit of time talking through that. Then we're going to get into how we can support you. So we'll go through some of the products that Moorepay currently is offering to both customers and prospects. I noticed we have got a mixture of customers and prospects on this webinar, and then we're going to open up to a live Q&A session and hopefully get some of your questions answered. So I mentioned before around questions, there is a box, and on my screen it appears on the right hand side. There should be a place where you can put in a question. This is how it'll appear to us. Only we as a host can see the questions. I can see who's asked them. Part of the Q&A, I'm not going to say who's asked the question, so I'll keep it confidential. But what it does allow us is after the webinar, we can go directly back to that person and get that answered for them. So any questions throughout today, put a question in there. Anybody who wants more information on any of the products or services that we offer, again, put a note in that question box, and we can certainly get some more information sent out to you. I have got just one slide here just to introduce who Moorepay are, just for those that haven't come across Moorepay before. It's your first time joining one of our webinars. So Moorepay are a market leader in payroll HR, serving the UK SMB market. We've been going, so this year it'll be 54 years we will have been established. We've got around 10,000 customers, process 500,000 pay slips every month. We handle 12,500 payroll and HR queries, and hopefully as we go through the webinar today, you'll understand some types of queries. A lot of the queries that we are answering, there's probably some of the questions that you're going to hopefully ask today. And then together with our parent company, Zealous, so who formerly NGA Human Resources, we pay 1 in 6 of the UK working population. And you'll see just some of the logos at the bottom there of some of the customers. So you'll see it's a diverse range of industries and also business sizes. So I'm going to hand over now to Michelle, who's going to take you through some of the updated stats on coronavirus. Over to you, Michelle.
Thank you, Dan. So for those of you who've been on the webinars before, we'll start by talking about the current advice and where we get this from. So we at Moorepay ensure that we stay on top of the government updates, whether they're daily, weekly, the new statistics, and then our teams work tirelessly in the background to take these, interpret them, and then think about how we can use this to help our customers. So just to start with, if we go on to the next slide, Dan. So I just wanted to start with the current updated stats and to give us an idea of where we are at the moment. So as of Monday the 30th of March 2020, it was reported that we'd had just over 22,000 confirmed cases in the UK, and that equated to 1,408 deaths. These statistics are updated on a daily basis on the government website. It is worth pointing out, though, that from today, the Office of National Statistics will be publishing a weekly update of extra deaths that have happened because of COVID-19. The stats that you see on front of you published by the government relates to deaths that have happened in hospital. But from today, we will find out what the number is that's happened outside of hospital. There will obviously be a time lag on registering those, which is why they're going to do it on a weekly basis, but we are likely to see a hike again today, along with the continuing daily updates from the government. The risk to the UK declared by the government is high, and you will see there the breakdown of cases and deaths across the UK by country, just to put it into some perspective. Obviously, the highest number of cases and highest number of deaths proportionally is in England, and we are seeing a huge concentration of this within London. Just on the other side is a small reminder of the symptoms that develop because of COVID-19. I think everyone's aware of these, but it is worth reminding people. The two main ones are coughing and fever. And these are the symptoms that the government are saying to look out for and self-isolate if you experience them, but it can also lead to a difficulty in breathing. We just go on to the next slide then. I wanted to take a moment to talk about the job retention scheme. When we did the webinar last Tuesday, the government had only announced it in the few days before, but as of the morning of the 27th of March, which was Friday, the government have updated their advice and given a lot more detail. When you get through the webinar slides and a copy of it, you will see that we have put the link that the government have produced in there, which gives them more detailed guidance. But I thought it was worthwhile for everybody on the call if we just summarised the main things that we now know. This is open to all UK employers for at least 3 months, and this is to be backdated to the 1st of March 2020. And it's designed to support businesses who have been severely affected by COVID-19. And employers can use a portal to claim for up to 80% for what is determined as furloughed employees. And these are employees that you will make absent from work. They are not required to do work for you, but remain on your payroll. And you can claim for up to 80% of their usual monthly wage costs up to £2,500 a month. The employees must have been employed on or before the 28th of February 2020, and it applies to full-time, part-time, agency or 0 hours or flexible workers. And as I said before, furlough means that an employee remains on payroll, but they cannot do any work for you during this time. An individual can be furloughed for a minimum of 3 weeks, and you must confirm it in writing. Some contracts may have a clause that allows employees to be notified of changes to terms and conditions, but in a lot of cases, this should be subject to some comms consultation and asking your employees to accept the changes to their terms and conditions. It is important to remember that before a week last Friday, furloughing was not a term that was regularly used in UK law. So in a lot of cases, it is difficult to decipher whether you have the correct clause, and therefore it's important to ask where you can to communicate with your employees and ask their acceptance of their change in terms and conditions. I will point out, though, that given the circumstances and given the uniqueness of this situation, The alternatives to furloughing are things like layoffs and redundancy, and it's highly unlikely that individuals or group consultations will refuse to accept these changes. The scheme was designed in association with things like trade unions and has their backing. Okay, if we go on to the next slide then, I am going to hand over to Phil, who's just going to talk through a little bit about home working.
Hi, thanks, Michelle. Yeah, people who've been on the series of webinars will know we talked about home working 3 weeks ago. I think it was. The weeks are disappearing into the mist. And at that point, we were saying that it's a short-term temporary measure. I think what we got over the weekend was a clear indication from the Deputy Chief Medical Officer, Jenny Harris, that we're in this for the medium term now. As she said, it could be 6 months before the UK returns to normal. Obviously, that doesn't mean that all the pubs are going to be shut and the parks are going to be shut and we can't go for walks. They will start to phase some of the stricter controls out over time. But over that next 6 months, these periods, these controls could be brought back in, relaxed, brought back in as the numbers of cases change. The way I'm reading this is that home working was one of the first measures introduced because the Chief Science Officer said it was one of the most effective to control the spread. Therefore, I believe it's going to be one of the last measures to be relaxed. So, yeah, we all rushed home working. We all got as many laptops as we could. We sent people home and left them there to work from home on kitchen tables, coffee tables, kitchen sides, or hopefully, ideally, some kind of home office. But probably as employers, we're not 100% certain as to what the situation is at home. Now, again, with this move into a more medium term, or as I put at the top, a new normal, employers might want to start to consider establishing what that baseline looks like. So what situation have people got at home? How are they managing to work? Do we need to give some basic guidelines to make things safer? I'm not talking about rushing out and buying loads of office chairs and desks for people at home. That might be required for the odd employee who's got specific medical conditions, but without assessing what people have got as a business, you can't make a decision. So it's just starting to think about that, and then moving on, if this becomes more and more of a permanent issue, have we got right policies and things in place? We've actually written a little bit about this on the Knowledge Centre, so if you visit the moorepay.co.uk website and search in there for home working, you'll find a little bit more detail around what I've just been talking around. So I'll hand back to you there, Dan.
Yeah, thank you, guys. I'm just going to go through a few slides on what Mopay are doing to help both customers and prospects. So these are some new products, new services, new consultancy that we've brought to market, and we were getting asked quite a lot from customers and prospects. You know, how can you help? Would you be able to help with X, Y, Z? So we thought it was really key to share what we've got with you guys today on the call, and then we're going to save quite a lot of time for some Q&As, because I see that we've had quite a lot of questions in, and I've also had emails in as well prior to the webinar as well. So I'm going to go through this quite quickly then. So in order to support businesses, we're finding there are some suppliers that are falling over, that they're unable to process payrolls and not as robust. What we've created is, for any new businesses looking to come on board, we've created a fast track implementation. And I think I've got another slide which explains that in a bit more detail. We've got cloud-based solutions, so all our software is cloud-based. Just bear with me, my laptop is trying to pause my screen sharing. Hopefully you can still all see it. We have an employee self-service, so especially as home working is now a norm for most businesses, employee self-service and allowing your employees to get access to their data and manage their HR tasks is quite key. We have payroll automation, we can now process payroll, so basic payrolls, all the lockdowns, any of our managed customers, also our software customers. We can add in there now payroll automation, so you don't have to jump into the payroll. You don't have to process that payroll. You can switch on the automation that the software will do it all for you. We've got a managed payroll support, so a lot of prospects are coming to us who they are currently using like an off-the-shelf payroll software, and they need a bit more support. They don't want to have one point of failure. We're also getting some customers that are coming to us and asking us around whether there's additional payroll support that we can offer in these uncertain times. They don't want to have one point of failure through their payroll manager. And again, we've offered and we're going to be offering some emergency payroll support to both customers and prospects. HR consultancy, we'll come on to that shortly, but we are offering a variety of HR and health and safety consultancy to both customers and prospects. We've got our 24/7 HR advice line. So any businesses looking to outsource their HR and health and safety, they can do so, and they can pick up the phone and speak to some experts on the other end. And you can also ensure that advice. So should you take best practice guidance from what we give, you can ensure that should anybody take you to tribunal. And then we've also got an EAP, so an employee assistance program. So especially in these uncertain times and with your employees all working from home, sometimes communication and being able to see, employees that are finding it difficult can be a bit of a struggle. Offering an EAP is a very good way, and it doesn't always have to be a negative. It could be a positive. It could be they're phoning up around something that's quite positive, and the employee assistance program can support them on that. So in terms of what we've done as a business to ensure that we, one, ensure that people get paid from a payroll point of view, and secondly, are getting the advice and guidance from a HR and legislation point of view. All our business is working from home, so the whole operation is still working from home. All our communication systems are all VoIP, so we've got Teams, we've got Ring Central, so we won't have any issues for, should you need to get in touch with us. We have a team that meet daily, so every morning they get on a call as a team and ensure that we can deliver our service. We're deploying software updates, so last night we deployed the SSP, statutory sick pay update, into our payroll and HR software. Emergency payroll legislation, so we've got around 60 developers that are ready and have been put on hold, ready to deploy any changes. So the next one they're working on is the job retention scheme. And then we've got around 200 payroll experts, again, all working from home, ready to process payroll. And also we've got our advice line that are all still operational as well. I mentioned before fast track implementation. So anybody out there, so this could be prospects, but it also could be customers that are bringing other payrolls on board. So they may have payrolls or other payrolls with different providers. We can get you set up within 48 hours. We can get that payroll up and running. There is a caveat to that it would just be a basic gross to net calculation. And we would pay via faster payments, but it ensures that should you find yourself in a real difficult position, we can ensure that we get your employees paid. It might not be correctly, or it might not be as accurate as what a normal month would be. But then the following month we'll do a basic payroll and we'll do back dates. Then we'll start getting your cloud-based solution set up, self-service, and then we can start to look to automate some of that for you. So that emergency bit, the 48 hours, is something that's new and something that we're offering and supporting businesses with. From a payroll point of view, I mentioned before, all our access is cloud-based, and we've got self-service in there for employees that can go in, and the managers can start approving various HR and payroll tasks. We've got flexible managed payroll support. So I mentioned before, we've got payroll experts that are ready to process payroll, and again, we can support you in whichever way you need and depend on your requirements. We offer a faster payment solution, so should you need to reduce your turnaround times, if you pay via faster payments, we can switch that on from both customers and prospects. You can reduce your payroll turnaround times. Mentioned before, we can automate your processes and your payroll, so that locked down those calculating pay for the software customers. You can automate those, so you're not having to go in and do it yourself. We've got absence reporting and analytics, so it's going to be quite key here. And like I mentioned before, we've updated our HR software to account for the COVID-19 sicknesses, and you can get analytics on that. And I think it's going to be quite key for businesses to analyse what's happening with absences in their business. We've got the EAP, which we mentioned before, and we've got also the HR and health and safety advice line, and we've put them into some new bundles. So anybody that's interested, please get in touch, and we can share those details. For the customers and again prospects out there, the emergency payroll. So this is where you're running a in-house, so using our software, but you're running it and you're processing it yourself in-house. Should you want to mitigate that risk of single point of failure, we can jump in and we can set up a retainer so that we can jump into your payroll and run it as a managed service should you give us enough time. If there isn't enough time, so should something happen and it's very urgent, we will ensure that your employees are at least paid. The HMRC have got their data and you are compliant. We'll do a scoping day, understand how your payroll works, provide you a preview, and we're always going to be there should you need us to process your payroll. From a HR point of view, I'm going to go through these very quickly, and then Audrey and Michelle, anything that you want to elaborate on, feel free to jump in. So we offer mentioned before, the 24/7 advice line, HR documentation, so we can work through all your policies, make sure they're up to date, your employee handbooks, make sure they're compliant and in line with legislation. Occupational health referrals, so we can do referrals for occupational health should the need arise, depending on the issue in your business. Indemnity insurance, so that covers awards and also the legal costs should any of your employees take you to a tribunal. We've got EAP, and I mentioned before what that EAP assistance program is, so that's something that we offer in the HR services team. HR consultancy, so we've got a range of HR consultancy that we can offer, from what's the correct process to furlough my employees, home working, risk assessment for home working, risk assessment for those businesses that are still operational. And then we're also doing daily legislation updates. Phil mentioned before the Knowledge Centre. Please go on there. We're updating the blogs on a daily basis. Is there anything that you want to add on there, Audrey, Michelle?
Hi, Dan, just letting you know, I think your screen has frozen. We're still on the support for UK businesses slide. But I guess just to everyone on the call, we'll make sure that a copy of the slides get to you, and you can see what the whole slides are. And we'll just let Dan try and kind of reboot those, but there are different slides. I'll give a little bit of an overview more about the HR services, and then I'm going to let Audrey talk in a little bit more detail, particularly around our HR consultancy. But around HR specifically, our advice line at the moment, as you can imagine, has been absolutely inundated with queries from our customers. And over the last 2 weeks, we have probably seen around nearly 2,500 transactions that we've completed on behalf of our customers. A lot of it is COVID-19 related, but the businesses who are continuing are still having what you would call normal and run-of-the-mill ER issues, and we are helping them deal with that as well. So it's keeping the wheels turning, as well as helping support businesses with the COVID-19 outbreak. And our advice line that works 24/7, 365 days a year, is on hand and ready to answer all those customer queries that are coming in either over phone or over email. We support with the HR documentation, so a lot of our customers will have already had policies and documentation that we have helped them create, and therefore we know the background of their policies before we do any advice. but it's certainly been a service that has been in unprecedented demand over the last week. And we are continuing to put everything we can into making sure that this is resourced and that we can get to all the queries as quickly as possible. The HR consultancy that sits alongside this is becoming an also really important piece in supporting businesses. And this is where I'm going to hand over to Audrey to talk a little bit more about what the team do and what the team have been doing to support with COVID-19.
Yes, certainly. We're aware, of course, that some people need some fairly intensive support in order to manage some of the situations we're now finding ourselves in. The HR consultancy team have traditionally worked both from home supporting clients over projects and also on site. And so we're pretty much set up now to provide whatever consultancy we can as a remote option, including video capabilities. And we're working with a number of clients now on, rather unfortunately, some very difficult redundancy situations, giving people some support through issues like choosing people to furlough and so on. It sort of differs from the 24-hour advice service in as much as our consultants can either chair meetings or sit in on a call and advise and actually draft the reports and so on. What we're finding is that a number of our clients are finding it easier, instead of buying sort of whole days, to buy sort of packages of time that work out with calls and other offline work as well. So we're actually finding that many of our clients are using this in slightly different ways to how they did before, but finding it quite valuable because things are changing so fast. It's kind of good to have one person working with you on the other end of a line. So certainly that's something worth picking up. I also just wanted to add to something that Dan said about the insurance, just to clarify. The policy can also cover as well health and safety, and that could be quite useful with any companies that are facing prosecutions and so on. It covers your legal costs for that. The EAP as well, I think while people are working from home, it's a really cost-effective way to offer in some extra support. I think we're all feeling the strain a little bit. And on the HR documentation side, just to clarify, we're keeping everyone up to date with their documentation in things that are nothing to do with COVID-19, making sure everybody's handbooks and statements of main terms are continue to be compliant. Anything else there, Michelle?
I think the only thing that I would add in is that obviously our normal HR customers are using a consultancy service for various reasons, both COVID and non-COVID related. But it is an option if we have payroll customers who are on the call now who would like some extra support with HR during this time, because we realise that it is impacting internal teams greatly. We can offer that for our payroll customers as a standalone service, and we can work through that. So if there are any payroll customers on here who are interested in getting some consultancy support, then they just need to speak to their account manager. Thank you for that, Audrey. I think it's now on to talk about health and safety.
Yeah, so we have hopefully my slides have reset. It did flash up saying my screen had froze, but hopefully you can see those now, and it's on the health and safety screen. So we have a very similar service in terms of the top level key features within the health and safety service as the HR. So we've got the advice line, again, that's open 24/7. We can support you with your your health and safety documentation, guidance, policies. Again, we've got the EAP. We can do consultancy. Obviously, all of it's going to be remote for the time being. And then we've got access to the HR Hub, which is a online portal where you can manage all your health and safety documentation, your risk assessments, and also get guidance. The HR Hub is also open for the HR and the employment law side as well, to get all your updates and templates and guidance. And then we're also, again, if you go onto our knowledge centre, we're doing daily guidance updates on COVID-19 as well. Anything you want to add, Phil?
Really, just on the health and safety consultancy. Obviously, we're in difficult times, different times, and as we mentioned earlier, the home working. One of the things that we're doing is helping clients talk through the home working risk assessments, making sure we tailor that to suit the client. The client sends that out, and then when the results come back in, again, we talk through the results with the client, trying to help them prioritize where they might need to actually do some extra things, or where they can just give some training or guidance to their workforce. So that's where the consultancy is at the moment. We're also gearing up and ready to start to support clients as ongoing or one-off pieces of work as they're prepared to go back to business as usual. Certain things that you might not think about before you go back into an office that's been shut for 3 to 6 months. Trying to make sure we've got checklists and support in place to help people before they go back to work, to make sure that they're not putting the staff at risk. And as I mentioned last week and earlier today, when we do go back and the government starts to relax these controls and restrictions, the virus is still going to be out there. There is still going to be a risk to employees within the general population and within the workplace population. So again, we're ready to help clients with that. We've got a sample risk assessment so we can help clients tailor, make sure that you've got the right cleaning regimes in place, and the other disciplines that you might need to do to make sure that even when we do go back to a more normal way of working, we're not ignoring the virus and we're not putting staff at risk.
Okay, thanks, Phil. And then we've also got a chatbot. Michelle, Phil, have you got any updates on the chatbot that's coming into our HR hub?
Yeah, I'll take this one. So in response to the unprecedented volumes that we've had, we have very quickly tried to look at other ways that we can support both our customers and other people with this sort of information. And I'm pleased to say that within the space of a few days, our product team have absolutely worked their socks off, and we have now a live chatbot that can be used. Now, at the moment, what you will see on the screenshot there in front of you is the log-on page to our HR hub. And in the bottom right-hand corner, the icon that you can see with the headset on, this is our Moorepay chatbot. Now, for those of you who aren't customers, you are able to go to that log-on page and use the chatbot without even logging into the HR hub. It is something that we are making available. And what we have in there is answers to questions around job retention schemes, so furlough workers, information on SSP, and information on self-isolation. As this gains traction and we understand more about the response to it, we will look to branch out and have more information on there, but we've started with those main topics. We are looking at putting it on the Moorepay website, and that will come within the next few days, but for now it's sitting on the landing page from the hub. So I'd advise all of you to please go and look at the chatbot and all the information that we've gathered on things like the Knowledge Centre and information that we have from the government, we have interpreted into questions and answers on here. And you'll find that when you type an answer and it gives you type a question and it gives you an answer, it will then try and predict what other questions you might want to ask. So it's a very responsive and intuitive piece of technology that we've been able to bring in really quickly. So once you have the details of that from the login below, please do go and look at it, and this should hopefully answer some of your questions. But it's something that we're really excited about.
That's great. Thanks, Michelle. So I think we're going to move over now to questions, because we've had quite a lot of questions come in. So first question that we've got is, how long can someone be furloughed for?
I'll take that one if you like, Michelle. There's a minimum furlough period of 3 weeks. The maximum period hasn't yet been set out. I guess that's a bit of a great unknowable. The government doesn't really know how long the crisis aspect of the situation is going to last. So at the moment we don't have a maximum, but there is a minimum of 3 weeks. So although you can't furlough people week on, week about in turn, you potentially could bring back somebody after 3 weeks and then furlough somebody different.
Yeah, that's great. Can you ask for volunteers to be furloughed if you don't need to furlough all staff?
I think you could. The way you need to look at it, I think, is in terms of your own operational need, the skills you've got in your workforce, the ones you, perhaps the people who are most flexible. You must be very careful not to choose anyone in a discriminatory way. So I think potentially you could ask for volunteers, but you'd need to set that out quite clearly so it was very transparent how you were actually selecting somebody for furlough. Michelle, I don't know if you've got anything to add to that.
No, I think you've answered the question quite well there. Thank you.
Another one, if you have 2 staff doing the same job, but you only need one of them, how do you choose which one to be furloughed?
I think here it's about applying common sense. Whilst we don't have any formal processes that need to be followed in the furlough and certainly not outlined in normal employment law, we would advise you to look at normal selection processes that you would use in something like redundancy. Obviously, they won't be as long or potentially drawn out as a redundancy process, but putting in place some kind of basic selection process, whether that is looking at experience, skills, length of service, to allow you to make a choice between one or the other. Because the only thing that you do have to make sure that you are conscious of is that the choices you make aren't made with the potential of a discriminatory basis. So some kind of documented reason as to why you have chosen certain people would always be advisable.
Okay, that's great. Another question, quite interesting one. If someone is currently off on maternity leave, can they request to come back earlier than planned and then be furloughed?
The answer to that is yes, they can. There are no special requirements around maternity. I think the thing to bear in mind is that employees on maternity leave are required to give notice of return, 8 weeks notice, if they want to return early. It would be up to an employer to agree to somebody coming back sooner than that and being furloughed. And I can see that might be an attractive option for someone who's in the unpaid part of towards the end of their maternity leave. There's nothing to stop them doing it, but it's up to the employer whether or not to make an exception to the 8 weeks notice they're required to give. Thanks.
That's great. Another question, what can we do if we'd like someone to reduce their hours? There would be a business need to keep that person, but there's not as much for them to do from home. Can you part furlough someone?
I'll take this one. There is no such thing as part furloughing. If you are furloughed employee, that means you are on payroll, but you are doing no work for that or for your organisation. What the option here is to look at short time working, where there is reduced work, reduced hours and reduced pay. This is something that you will need to look at the contract or handbook for to see if you have a layoff and short-term working clause before you invoke this, and we would recommend that you seek advice before you do this to make sure that you've got all the relevant letter templates and you approach this in a fair and consistent way.
Okay. When furloughing staff, do we need to amend their current contract or just prepare a written agreement and leave the contract in place?
We would say that you do not need to change the overall contract, but you would write a letter to them asking them to accept the change in terms and conditions, because this is a temporary measure and you must make sure that it is all documented and that you keep copies of the letters that have gone out and the returned acceptance. And in the event that they can't sign, scan, post back, what have you, that they can email back their acceptance and you keep a record of that. But there isn't a need to rewrite all the contracts that you have got. This is an amendment to the contract that is kept separately. Anything you want to add on that, Audrey?
Yes, just one thing. A couple of questions have come up to my team this week. People asking if we can put furlough into the employee handbook. Obviously, the last thing you want to do is to commit yourself on a permanent basis to a kind of layoff and 80% of pay situation. So I'd just like to reinforce what Michelle said there. Keep it separate. It's a temporary measure, and you must be careful not to set a very general precedent allowing you to do that, or it could cause you difficulties in a different scenario in a different time.
Okay, another question we've got, we have work in our factory. As we are a key supplier, some of our staff have underlying issues such as heart problems. Are these people still able to continue to work, or do they need a medical assessment, sick note, in order to claim sick pay? Can we furlough them on a health basis if the workload is reducing?
There's a few kind of questions in there, but I'll take it step by step. So in the last week, the government have been writing to approximately 1.5 million people who are categorised as extremely vulnerable and asking them to self-isolate for at least 12 weeks. If you have an employee who is in that category, then by default of them having that letter from the NHS, then they would be entitled to their absence to be classified as a sickness absence and therefore entitled to SSP if they are eligible. If there is anybody else who comes to you with concerns about underlying health conditions, but they haven't been identified in this category, then there are a number of things that you can do. One is that you can look at what measures you can put in place to make sure that they feel safe and secure whilst they are in employment. And this might be where you need to get some health and safety guidance around risk assessments and helping make sure they're protected. Some of the advice that we've been given to clients is if you still have employees that are concerned, then it is up to them to talk to their GP and find out what the best course of action is. You can furlough employees if work is diminishing and you think that is the best thing to do. There is nothing stopping you doing that. But furloughing for medical reasons is obviously not what this scheme is intended for.
Yeah. Okay, that's great. Thank you. Another question. What happens with grievance procedures that were in progress pre-coronavirus? Do they get put on hold due to other priorities in keeping business running?
I would say that if you can continue to deal with it, you should continue to deal with it. I realise it may be difficult if, for example, you've not had a grievance meeting. It certainly may cause you some difficulties if a grievance is close to being resolved and the things that the parties need to do to kind of get things back on track are not doable, perhaps because people are working from home. In terms of the sort of long term, it's likely that should you be so unfortunate that a grievance situation ends up in some kind of litigation, it's fairly likely that tribunals will be sympathetic to delays caused by the current situation. But my advice would be, if you can hold a meeting, even if it's a remote meeting using video capability, and you can carry out investigations, please do so. If you're just working flat out because of what's going on, always keep the communication channels open, talk to the person who's raised the grievance, explain the difficulties, and try to come to some sort of agreement between you about how and when it'll be addressed.
Okay, that's great. Can you furlough someone for 3 weeks and then let them come back to work for a period of time and then furlough them again if need be?
The only answer I can say to that, as far as we know, is yes, unless you know differently, Michelle.
I think this is still one that's a bit unclear and kind of looks at whether you're part-time furloughing someone. I'm hoping that we will get clarification in the next few weeks over the exact answer on this. But there is a potential that could be done further down the line. But again, I would seek advice before you do that.
Okay. Is there a minimum notice period to furlough?
No, there isn't. You can furlough people immediately.
Okay, I think just due to timing, I'll pick one more because we have had quite a lot. I have a staff member whose wife is heavily pregnant. Should he be working from home ideally, as his wife is vulnerable?
Do you want to take that one, Phil?
I was going to say, shall I tick on that one? I think the indication there, the hint in that question is that the guy can homework, and the government guidance is where people can homework, they should homework. So I think that sentiment answers that question. If it is possible for that employee to work from home, then they should be working from home.
Okay. I think we've just hit our time now, so we have had, and thank you for all the questions that you have sent in. We have got quite a lot there that we didn't manage to get through. A lot of them were very similar, so hopefully you got an answer. But what we will do is we're going to download all the questions that we've got. We're going to get them answered, and we'll share a document with you all with all the questions and answers. It may not be today. We're hoping that it'll be back end of tomorrow, just to give us time to get through all the answers. Some of them are payroll related, so we'll have to go to our payroll product team just to get some of those answered. But I would like to thank you for joining. We are going to do another webinar next week. We will be again updating on any new legislation, any new updates, any new stats, any new product updates that we've been working on. So I would like to thank you all for joining, and I hope you all have a great day. Thank you. Bye bye.